The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hi, everybody. Welcome to Ageless Health with yours truly, Dr. Tom Roselle. And I have a great program for you, one that is painfully poignant. What am I talking about? I'm talking about your head. You know, those headaches, those migraines, those cluster headaches, all the craziness that you normally get. We're going to talk about that, but we're going to talk about what really the triggers, what's going on with it. And by the way, those of you in the Washington metropolitan area, that's leading up to a program that we're going to be having in-house March the 18th. At 6 p.m. at the Roselle Center. And listen, if you've been suffering from any type of headache that just never goes away and you're on a horde of medications, things that you really don't want to be on anymore, why don't you join us that night? I'm going to be doing a program with Dr. Zhang, Qinglong Zhang. He's a traditional Chinese medical physician and a chiropractor in combination. What an opportunity, right? And you're going to get the ability to hear from one of the best, as far as I'm concerned, in the business. So join us, give us a call. You can 703-698-7117, or simply go online at drtomroselle.com and register there. Love to have you. The only thing that we ask is it's a gift to you as a community that if you can't make the class and you've signed up for it, give us a call 24 hours before and let us know that you're not going to be there. That's it. So we can make room for somebody else. Let's get into the program. Let's talk about that throbbing head of yours, that pounding that just never seems to want to go away. It's important. It's critical that you know why those things are there so you don't end up on 20 different types of medications. I'm telling you, the people that come into this office who suffered chronically from pounding heads, the medication that they're on should give them a pounding head, and it often does because that's some of the side effects. The cure often is much worse than what they've been suffering with. But let's talk about those things. Let's understand what it is that we're dealing with, and try to get you resolved relative to your suffering, if you will. So, what's a headache? Headache is obnoxious, right? And by the way, before we get into the types of headaches and what they are and how they're characterized, here's the situation. Headaches are the number one cause of financial disruption, period, end of story. It's the number one reason people go to a doctor's office for anything else. Doesn't make a difference what the condition is. It's the most expensive condition, period, because it's ongoing. It never goes away. And medication that you take causes side effects that you take other medications for. And literally, I'll give you an example. There was a guy, this goes back a couple, 3-4 years ago. He worked for the FDA, and he was on 22 different medications. You heard me right, 22 that he took every day. How could somebody that worked for the FDA, well, maybe that's an oxymoron, I don't know, that was on 22 different medications? One caused a side effect, so they gave him something else for that. Another caused a side effect, so he did. And when I told him that perhaps it was the wrong approach, he took offense at it. And I said, look, your medications that were designed to help you are actually causing further problems. So I would encourage you that maybe that we have to modify them. And he really got angry with me. And he left the office. And it was probably another month before he came back. And he said, I really was upset with you. I said, why? Because I told you the truth. And here's the situation. If you want to know, and this is a sidebar, but if you want to know if the medications that you're taking for other conditions may have caused these ongoing headaches that you've had, these throbbing, these pounding, these ugly sensations that devastate you and stop you from being productive, go to drugs.com. Drugs, drugs.com, right? And put your medication in there and see what the side effects. Then they have a site that you can compound all the medications you're taking and see what the side effects are. My guess is that if you've never had didn't have a headache before, and you started taking a medication for whatever the situation was, that perhaps, just perhaps, that may be one of the triggering mechanisms. But let's talk about the different kinds, right? So headaches are common. They're not something that we want to have, but they're characterized by pain and stabbing and throbbing and knife-like sensations and tension and just dull like an elephant sitting on your head. So if you have that type of thing, yeah, you got to probably have a headache, right? So, but we need to find out not only do you have a headache, what kind of headache is, and can we do something about it? So this pain that you're going to get, this dull, this throbbing, this knife-like, this explosive type of feeling, this sinus-like pressure that may not be sinuses at all, where are they coming from? What's the triggering mechanism? Why do you have them and nobody else has them? When a patient comes into our practice, I take the time, my doctors take the time to do a thorough history. History is 80% of the diagnosis. You find that if you ask the right questions, you find really what took place. A lot of people have triggered from years. I'm going to give you something that's happened in my world and why I do what I do. Many years ago, we're talking about many years ago, my wife had migraine headaches. Matter of fact, she started getting them when she was about 6 years old. And she'd get the nausea, she'd get the vomiting and so forth. And she was on all kinds of drugs and meds and so forth. What they told her when she was in her 20s, that her migraine headaches, these headaches that she would get every week, that it was coming because her neck was reversed, meaning that your cervical spine, the neck, has an easy C-shaped type of configuration. And in her situation, that C-shape was in the wrong direction. And it was simply because of the fact that she was an intense student. Her head was always down, looking at a book. How about today's world when we're on iPads and cell phones and things like that? And they had her on meds. But you know when the headache hit? The headache hit on the weekend when she wasn't studying, when she'd take a break, and then the muscles in her neck would relax. But what caused the migraine was the blood supply that goes through the bones of the neck. They're called the vertebral arteries. They go all the way up and they come to the base of the brain like this, and they form one artery called the basilar artery, the base artery. And during the week when she was head down and so forth, the blood supply, if you would, was restricted. Now, when she relaxed, the blood supply opened like a valve and flooded the back of her head. And because the blood vessels had adapted and narrowed, they couldn't handle the volume. So you know what the solution was? They wanted to fuse her neck from the second bone down to the seventh, cervical 2 to 7, to try to get the curvature back to where it needed to be. I said, I don't think so. So she started into a chiropractic clinic in Elgin, Illinois. And within 30 days, her migraine headaches were gone. 30 days. That's all it took. 30 days. She stayed under care for a considerable time after that to get the curve to go back naturally, like putting dental bracing on the teeth and getting them to reform and sit the way they're supposed to sit. And to this day, decades later, she's never had a headache again. Now, how about you? Are you willing to put up with all this nonsense? Are you willing to deal with the onslaught of continued life-stopping, life-changing headaches when there might be a different way? Well, pay attention, because we're going to go through the different type of headaches and why they're there and what they're called and why you get them and so forth. All right. So let's start with headaches are a common condition. They're characterized by pain in the face, in the head, the back of the head, on top of the head. It could be knife-like, somebody sitting on your eyeballs and pushing all the way through. It could be this sinus pressure that you get and you think it's sinuses, so you're taking all this nose dope and stuff of that nature. It could be that, you have this inflammatory reaction. But let's talk about the types. If you go to the medical literature, it's kind of interesting. A headache is defined as pain, discomfort in the head, the face, and the upper back of the neck and so forth. No kidding, right? So the pain may vary in intensity, where it's coming from, location, how often you get it. And then they try to divide it into primary and secondary headaches. What does that mean? Well, what they're talking about, these headaches are the primary headache in medical literature says it's not being caused by another medical condition. Okay. That means that it's not a cancer, it's not a space occupying tumor, it's not a bulging of a vessel. Now, those types of headaches are pathological, and we'll talk about those at some point. But a primary headache is a tension type of headache. It can be a migraine, and by the way, a migraine headache is what? Is a vascular headache. I want you to remember that. A migraine headache is a vascular headache. It's not that the blood supply is being torsioned or torqued or bulged and so forth. It can be restricted. It can be inflamed by a lot of things. We're going to get into that a little bit today. Cluster headaches, they're extremely painful, mostly guys more than women. And they cause this disruptive pattern. It's like somebody shoves a knife right into your eye. And it's usually, again, more guys than women. And it's accompanied by, sometimes just a flush of mucus secretions and so forth. But it comes out of nowhere. You have secondary headaches. What's secondary headache? Secondary headache is pressure on the sinuses. It has to do with medications that have the compounded side effects. We talked about that a moment ago. It has to do with other medical conditions. So when you know that's true, when you know these things are coming about, you have to look at the triggers. And this is the most important piece that you have to remember. The triggering mechanisms are varied. They can be stress patterns. They can be your dietary patterns. They can be unbalanced hormones. They can be office odors. And it keeps stacking. And you go away, you get outside of wherever you live, and you relax a little bit, and the air's clean, and you have high ionization at the top of a mountain or a river or an ocean, and you feel much, much better. So now your question is it the ionization? Is it the lack of stress? Are you eating better? It's not catch as catch can. All of those things are considerations that you have to look at. How many of your doctors ask you this question? When was the very first time that you ever had a headache? My guess is that they don't ask the question, because I see that on a day-to-day basis, that people come in and the doctor put them on all kinds of medications, and they say, let's see if this works. And, we'll see if we have to do anything more than that. They send them out for films. They send them out for CAT scans. They send them out MRIs. They do all kinds of studies because it's, in my opinion, it pads the bill a lot. And we talk about hundreds of thousands of dollars sometimes to diagnose something that is very simple to deal with. But are they finding the cause? Are they finding the trigger? Do they ask you, do you ever have an injury? What kind of sports did you play growing up? Where did you live? What kind of stress patterns are you on? What's your workplace on? When was the very first time you ever remember having this type of problem? Now, here's the situation as well. How about your eyes, right? They talk about when you have a migraine headache that you have visual disturbances. It's something called an aura, which we'll talk about migraines a little bit more specifically as the program goes on today. But that aura is being caused by several different things that disturb the eye vascular bed to begin with. Now, it can come from the base of your skull. And if it does come from the base of the skull, it's because the bones of the upper part of your neck are out of position. They're putting pressure on not only the brainstem, but the blood supply, the vertebral artery that goes through the back of the neck to the head. And that can be the triggering mechanism. How many of you do social drugs? Yeah, I said it, right? Unfortunately, it's common in today's world that there's more and more of us that are looking to, do some THC, weed, marijuana, whatever you want to call it, and other types of drugs, on cocaine and so forth. Those things will cause headaches when you're not using them. All of a sudden, you feel dull, you feel listless, your head feels like it's got a lot of excess pressure on it. So could that be the trigger? Maybe. How about if you're taking different types of anti-inflammatories just because. We did a in-house presentation the other day, and one of the patients asked me, or potential patient to the practice asked me a question, and it was about, well, I take these types of medications. Can that cause further degeneration? Well, the truth of it is, yes, it can, because now you get a rebound phenomenon. Body reacts this way. It tries to normalize itself. So if you suppress something artificially and you're no longer suppressing it, will it rebound back into a different platform? The short answer is yes, it will. It'll rebound very rapidly, and that can cause the pressure within the head. Again, go to drugs.com, look up the side effects or the compounded effects of your medication. Sometimes it's an allergy reaction. It's important that you understand that the epigenetic, the environmental impact of your body's mechanics, the epigenetic impact of the inflammatory reactions due to foods and poisons and additives and all those things can cause a problem. And then at the end of the day, your compounded stress effect, that you chew on something, you go to bed with it, and there's an issue. Now, look, if you knew there was something that you could do about it, if you knew there was something that you could resolve, wouldn't you want to? Well, we're going to give you some information, a lot more than I'm going to be giving you over the next hour. And the information that we're going to do ongoingly is simply this. Coming up on March the 18th, okay, 1/8, coming up very quickly, at the Roselle Center for Healing in Fairfax, Virginia, Dr. Qinglong Zhang and I are going to do a back and forth on migraine headaches. What an opportunity you have to hear from one of the best in the business, my opinion. He's a traditional Chinese medical doctor as well as a chiropractor. He gets the stuff. He understands it intimately. He's amazing at what he does. But wouldn't you like to get rid of these things? Wouldn't you like to, be resolved for the first time, maybe in decades, in years? And you've been putting up with this, and the medications are getting worse, and you don't know what to do. You don't know which way to turn. And now with all this online stuff that you can get any medication, any drug you potentially want just by picking up the phone, are you being your own doctor to a fault? There's times that you need to take control, but you need to do it with, natural things, my opinion. Medication should only be used as a last resort because they have their ongoing stacking effect. So look, if you know you have a sensitivity to something, if you know you get tremendous headaches in the spring called allergies, if you know you get tremendous headaches in the fall called what? Called hay fever, maybe there's a way to resolve that you don't know anything about at this point. Well, we're going to teach you that. We're going to get more into it today's program. Understand that it's critical that you allow your body to optimize itself instead of the pounding, instead of the knife-like pressure, the feeling like somebody's sitting on your head. Your head's going to explode. You don't know what to do about it. You're going around all the time and just holding your head like this. And you say, oh my God, oh my God, oh my God, what am I going to do with it? Well, you can do something about it. And we're going to show you how to make that happen. It's important that you understand that you have control. You have the capacity, you have the ability to resolve virtually anything. I've never seen a headache other than a cancer tumor or an aneurysm in the brain that can't be made much better. But you have to understand what it is that you're treating. It's not just happenstance. It's not just guessing. Guessing doesn't work. It makes things much more severe over time, and it has its side effects. It has a compounding irritation of what you're trying to treat it for if you're not doing the right thing at the right time. Has to do with who we are as human beings in today's world is very different than it was years ago. So we're going to give you some more of those clues as we go through. We're going to give you some more of the differentiating features, but more importantly, why, after all the money that you spent, all the people that you've talked to, all the things that you've done, that you're still stuck with them. They don't go away. We're coming up to a break in the program, and don't go away because I got so much more information for you. Just don't have enough time. You're listening to Dr. Tom Roselle Live. We'll be right back. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Roselle. My patients always ask me to recommend products that I personally use, so I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com. Hey, everybody. Welcome back. This is Dr. Tom Roselle. You're listening to Ageless Health with yours truly, obviously. And we're getting into a discussion today, if you will, about headaches. But all kinds of crazy headaches, but why they won't go away, all the things that you've tried that haven't worked, right? How many of you on medications? You go to the doc and they're well-meaning people, but they write a prescription. So here, take this, let's dumb it down. Well, let's try this, let's see what happens. Let's send you out for a CAT scan. Let's send you out for an MRI. I'm not sure where they're coming from, but if the medication seems to help, let's keep you on it. Does that make sense to you? Doesn't to me. I talked to you a little bit about what happened to my wife many years ago with her migraine headaches, and they wanted to fuse her neck. They wanted to surgically go in and fuse the seven of the vertebrae in her neck from C2 down to C7. Now, what would that have done? Nothing. It would have made life much worse for her and probably caused other kinds of irritation where she would have pain in her neck and her face and so forth. Is there a better way? Yes. The better way is finding out what the cause is. The better way is trying to figure out what really is triggering this. I'm going to give you some kind of bizarre examples of what happens, that can cause headache problems and so forth. In traditional medicine, they're looking at this drug for this symptom. In the world that I come from, we're looking at how to fix the pain pattern, the dysfunction, by understanding what the triggering mechanism actually is. Now, I want to take you to a structural platform to begin with. As you're walking and moving, your shoulder moves with your hips move with your shoulders, your wrists move with your ankles, and your neck muscles move with your feet and the rest of your body. I said feet, right? So if that's the case, if your feet are moving, and can they cause problems with neck balance? And if your neck is not balanced properly, can the vertebrae, the bones of your neck misalign, put pressure on the nerve roots, maybe triggering that headache, and it's coming from your foot. It's coming from your feet. So how you know that is this. A patient comes into our office and we're going to check neck muscles. We're going to test the muscles. If they weaken, I'll often have the patient pull their foot up like this, and then I'll retest the neck muscles. If the neck muscles strengthen, then I know that the foot's involved in some way. There's a bone in the foot, it's the largest bone in the foot, it's called the talus. And often if that talus is out of position, if I move it back into position and tape it so the ligaments can heal around it and treat it a few times, all of a sudden those neck muscles get better. And guess what happens? The headaches seem to disappear. What was causing the headache? Well, mechanically, there was a distortion of the head and neck, causing pressure on the back of the neck, because now there's no pressure here holding it neutral. The neck locks back like this, puts pressure back into this area. And the nerves that come out, there's one that comes up over the top of the head. It's called the greater occipital nerve. What's the occiput? This old noggin of yours. Then there's one that comes around like this. It's called the lesser occipital nerve because it's smaller. It's down through this area. That can cause a problem. The neck flexors also can cause a distortion on your TMJ, your temporomandibular joint. Now, if this doesn't open and close the way it's supposed to, the 22 bones that make up your head are going to jam and they're going to lock into place. They'll increase the fluid buildup, pressure that's not moving the way it's supposed to. So all of that happened because of what? You dropped the arch in your foot and your talus, that big bone in your foot, dropped out of position. If it dropped out of position and it stays there, then this whole mechanical distortion continues. And what? Now you have pain that doesn't go away. You're relying on medication. Nothing seems to make a difference because nobody looked at the intimacy of the mechanics of the body. That's just number one. On the head, you have acupuncture points that either start or end. Out here, you have gallbladder liver point. It's gallbladder 1 by definition. Right here on the face, you have what? Stomach 1, which is also spleen blood sugar transport. Up here, you have triple heater that has to do with what? Thyroid function, the outer covering of the heart, and so forth. Back here, small intestine and heart. So let's take it in an observation that I look for all the time. Let's say the patient says, oh, my head hurts all the time. I get pain here. Feels like somebody's sticking a knife in my eyes. And it seems to be coming from back here. Well, the first thing I'm going to check is I'm going to check different reflexes that have to do with gallbladder function and liver function. This is gallbladder 1. This is a major gallbladder point. So if they point to here and they point to here, my headspace is going to start thinking liver, gallbladder, and I'm going to start looking at dietary patterns and things of that nature. If you don't look at it that way, you never fix the problem. It never goes away. It stays there on an ongoing basis. So where is your pain? What's it like? Is it electrical? Is it sharp? Is it pressure? Is it explosive? Is it throbbing? Have you been asked those questions? Then have you been asked other defining questions about, do you get it after you eat? Do you get it at nighttime? Is it in the morning when you wake up? What's that got to do with anything? Well, if you wake up in the middle of the night with a headache, you could have a blood sugar headache. Oh, my head kills me at nighttime. It's what wakes me up. Well, what triggered it? What was the reason for it? Those are the pieces of the puzzle that you have to answer. Now, remember, brain, spinal cord, 31 pairs of nerves. They divide. One branch goes to organ, another branch goes to muscle. So they're talking all the time. So you can not only have this organ relationship, gallbladder, stomach, large intestine, small intestine, that's being involved because you're foolish in the way that you eat, or you can have some other mechanics. Let's talk about, we mentioned that temporomandibular joint. This is the pump handle, if you will, for the rest of the skull, the 22 bones that make up your head. 22 bones that make up that head, 22 of them. And they're all little sawteeth interdigitations that as you breathe in and out, they expand and they contract. They expand, they contract. They expand, they contract. So if that's the case, what are we going to do about it? Did you go to the dentist and they put braces in the wrong way? Did they put a post in the wrong way? What happens? How about knocking down the inflammatory reaction? Look, there's a lot of good things out there that you can do to decrease inflammation. There are a lot of herbs, if you will. Some of my favorites are things like feverfew. Feverfew is known and tried for years and years and years. It's an anti-inflammatory herb that may reduce migraine frequencies and tendencies over a period of time. But it still doesn't answer the question, what's triggering the migraine? So you can still gotta figure that out, but it helps. Ginger also. It's amazing how it will act as an analgesic relative to headaches. You can put it in tea, kind of get a piece, chop it all up, put it in your tea. Peppermint as well. It's staying extremely hydrated, lots and lots of water. Get in a couple liters of water or more, 2.5 a day, up to 3 liters of water a day. I said 3 liters, it's a lot of water, but it's half of your body weight. And you'll find that it'll shift. There's an herb called rosemary. We put them in sauces and add flavor, but what it does, it also helps promote the dampening, if you will, of headaches and decreases the inflammatory reaction. And by the way, if you go to our website, if you go to drtomroselle.com and go to Ageless Health Store, and you go into the Ageless Health Store, we have an area for you that you can buy a lot of these herbs. You can find them. You can buy nutrients and so forth. Please do it. Check it out. Again, these are not fixes, but they're things that won't get you in trouble unless you know that you're allergic to certain things. Then absolutely don't touch it, right? Because I don't want you to have an allergic reaction that's going to cause what we're trying to get rid of. So, but it's there available to you. We put it up there on purpose. And by the way, when you go into the Ageless Health Store, you're going to see 4 different products that I've put up there for you to use during the winter months and keep your immune system nice and strong. There are products that I use, my patients are encouraged to use, my family uses, my staff use, to keep us well, keep us healthy. So I'd like to encourage you to check it out. But anyway, let's get back into the program. We're not here to sell you stuff. We're here to let you know that there are things that are available to make sure that you understand that you have options and opportunities relative to your headaches. Do you know what a tension headache is? You'd actually, well, you got a tension headache. What's a tension headache really? Tension headache is something that affects the structural alignment of the bones of your neck and of your skull plates. It can produce anything from a very mild headache to a very severe headache. It can feel knife-like somebody's putting a knife in the back of your head. Particularly when you move around, it can either be made worse or it can be made better. Trauma, injury, accidents, things of that nature can move the vertebrae out of place. In my world, we call it a spinal misalignment called a subluxation. In the osteopathic world, that misalignment is called a spinal lesion. And it's known to be able to be modified dramatically. If the vertebrae are out of position, they're not aligned the way they're supposed to, you can get them back into position with specific movement of the spinal bones. It's called a spinal adjustment by somebody who knows what the heck they're doing. Don't let anybody play with you that says, oh, I know how to do that. Let me try. Don't ever do that. Go to a chiropractor, go to somebody who knows their business and make it happen the right way. Look, these things can shift. These things can make a major difference. Coming up, by the way, March, again, the 18th, Wednesday evening, 6 p.m. at the Roselle Center for Healing in Fairfax, we're going to be doing a whole night on headaches and migraines and the things that you need to do to get rid of it. I promise you, if you're suffering from headaches and you've been on every drug known to man, you haven't done everything that you should do to help yourself. So let's make a difference. Let's help you, right? Call us 703-698-7117 and tell our staff that you'd like to be there, or simply go to drtomroselle.com or rosellecare.com and sign up for the class. And the only thing we ask you, as always, is that if you can't make it, something happens. Well, things happen, right? Just call us and say, hey, listen, I'm not going to be there, so we can make room for somebody else. It's important that you have the tools, if you will. And I'm here to give you the tools. I'm here to tell you what to do. I'm here to get rid of all that nasty, that crazy that you're suffering with for so many years, so long. Isn't enough enough? Isn't now the time to get it done? I don't know about you, but I sure as heck would like to get it done. So join us, Chronic Headaches and Migraine, March 18th, 6 p.m. If you're in the Washington metropolitan area, I'd love to have you as my guest, and we'll sit there and we'll answer all the questions that you have for as long as we need to do that and help you. And by the way, if you need information before that, or if you need more information other than what I give you on the program, simply do this. Go to drtomroselle.com and send me a note, and I will answer you. I'll get back to you. They make sure that I do, and I don't forget. I always reach out and do what I have to do to make a difference for you. Look, this is a situation that too many people suffer from. Migraines are the worst financially devastating condition that there is. You would think that cancer would be, right? Or heart disease would be, but you die from that stuff. I'm not being light about it. I'm sorry if I'm being a little flippant. But if you suffered with migraines for decades, I promise you the amount of money that you have spent, the diagnostic criteria that you have spent. But here's the thing, your inability to work because you can't think, your inability to function and take care of your family because you can't think, because the pain won't allow you to do it, the loss of your productivity to your employer and to society because you can't function, because you can't think. And the medication that you take dumbs it down so much that you can't get it squared away. Look, we're coming up to a break in the program, and I want you to begin to think it through. We're going to kind of, stack it for you in just a little bit, but I want you to think it through. How long have you had the headache? What have you done about it that hasn't worked? Are you on medications just to be able to function? Are you doing things that, just seem to be minimally in their platform? Wouldn't you like to find out why and to be able to have the opportunity to be able to resolve it? Well, I'm going to give you that information, and we're going to stack and so forth. And when we come back after the break, I'm going to give you some very specific things that I want you to try. I want you to see if it really triggers those things. So you're going to be surprised, little things, very, very little minor things that I promise you nobody has directed you to do. But if you do these and it says yes, 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 then you have something that you can resolve, getting the right information at the right time and the right applicability. Migraines, headaches, sinus pressure, and so forth are ugly. And we're going to cover all of those on March 18th at 6 p.m. at the Roselle Center in Fairfax. So if you're anywhere near us, make sure that you join us, please. This is something that's near and dear to my heart because you can resolve almost immediately. So if you can do that, show up. I'll show you what's happening. What happens if your foot is causing your headaches? What happens if, you went to the dentist and your teeth are misaligned worse than what they were when you went in to see them? Could that be causing the problem? Maybe. And if it is, wouldn't you like to get rid of it? I don't know about you, but, I'll give you some questions that you need to ask your dentist. I'll tell you what to look for if maybe the guy's not doing the right thing. There's lots that you can do to help yourself. And I want you to understand that on the 18th, 6 p.m. at the Roselle Center in Fairfax, join us, and you'll go away with more information. You'll make your dentist crazy. You'll make your physician crazy. You'll know more than they do. As those of you who've attended, the information we give you is like drinking from a fire hose. That's what we do. That's what our mission is to serve you, to give you as much data and information as we possibly can. So look, we're coming up to a break right now. When I come back, I'm going to recap some of these things. I'm going to tell you a couple of things I want you to try that will tell you where your headache is coming from. And listen, it's my mission. My mission is to turn you around, right? Don't go away. You're listening to Ageless Health with yours truly, Dr. Tom. I'll be right back. Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Roselle. My patients always ask me to recommend products that I personally use, so I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Red wine is high in a substance called resveratrol. The so-called miracle molecule found in red wine might help improve mobility and prevent life-threatening falls among older people. Mobility problems are particularly common among older people who have Parkinson's disease and other age-related neurological disorders. The research says that this important finding could lead to the development of a natural group of products designed to help older Americans live safer and more productive lives. But before you stock up on red wine, Dr. Jane Kavanaugh says that you can get this naturally occurring substance in larger and pure amounts through dietary supplementation. Red grape juice, red grapes, blueberries, and nuts supply the same amount of resveratrol as red wine. If you're trying to stay upright, do core training exercise, eat your veggies, take resveratrol supplements, and drink red wine in moderation.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Hey everybody, welcome back. Dr. Tom here. You're listening to Ageless Health. What a program today, huh? It's one that is devastating, disabling to so many people. Because if you got that headache, you can't function. You don't want to read anything. You don't want to talk to anyone. You want to kind of isolate yourself. You know, you become kind of a curmudgeon of sorts. Make sure you understand that you have the tools to reverse this. Coming up, as I said, March 18th, at the Roselle Center for Healing in Fairfax, we're going to be doing a whole night on chronic headaches and migraines and what to do about them and show you how to take it. But I'm going to give you some options today. We talked about the different types of headaches today. We talked about, the cluster headaches, touched upon them just a little bit, said they're more guys than women. They're one-sided, feels like a knife is in your jaw and your eye at the same time. They come out of nowhere, just boom, they're there. The tension headaches, if you will, that are really coming from misalignment of the vertebral segments, the vertebrae, the bones of your neck. We talked about migraines, and I said to you early on, a migraine headache is a vascular, it's a blood supply headache. Now, what does that mean? It means the blood supply restricted? Sometimes. Does it mean that there's some kind of poison in the blood? Not necessarily, but there's inflammation, which actually is, devastating like a poison. So, but where's it coming from? Why do you have it? Is it allergy reaction? Is it heavy metal formation? Is it toxic environment? Where is it coming from? Do you have a misalignment of your temporomandibular joint? Are your teeth off and they're not hitting the way they're supposed to, so they're causing the distortion of the 22 bones of your head? Are you getting intestinal tract problems because the large intestine ends here, gallbladder's up here, small intestine's over here? That can be triggering all those things. We talked about your neck muscles that may not be holding the way they're supposed to. So it's allowing your head to jam backwards because what? Your foot is not doing what it's supposed to do, that there's an arch that is being distorted because of the drop in a bone called the talus. So we have all these little things that could be stacking. How about the meds that you're taking for something else other than just a headache? But they're causing the headache. And your doctor says, well, you got to learn to live with it. Take this NSAID. Meanwhile, you're taking so much aspirin and NSAID that you're bleeding all over the place, that your blood count is being distorted and so forth. Understand that medications, no matter what they are, have side effects. You have to make sure that you understand that. I wrote a book some years ago, and we're going to be in the process of doing a second edition. If I get my tuition gear here and get it done, it's called Ageless Health. Health is a do-it-yourself program. The audio version is still available. If you go to drtomroselle.com, go to rosellecare.com, it's available that way. So get the audio version. It's all there. There's also, I think we still have some of the PBS special video versions of Ageless Health, the TV special. It's a 90-minute program on some of the most amazing resolutions of devastating conditions that you could possibly even begin to think about. But anyway, check it out. And whatever we can do to help you, just reach out and let us know. We'll do whatever we can. That's why we're here. Our mission is to serve you, is to educate you, to empower you in your own journey to make a difference. Not me, it's you. This is why we do what we do. Remember I said that I'm going to give you a couple of things to check out. So little things that you can do. Open your mouth really wide. If you hear a big old pop or it's difficult to open your mouth, it's an indicator that, in fact, your temporomandibular joint is not moving the way it's supposed to and could be causing those pressure headaches that you're getting, particularly in the side of your head or in your eye. Clench down a little bit. Same thing. If there's a problem, do that. You can be your own muscle tester. Just drop your head down, turn it a little bit, put your hand on your forehead and push like this and see if you can stop it. If it's weak, then I want you to do one other thing. Then take your foot and I want you to bend your ankle like this towards your head. Okay? Bend your ankle towards your head and then go back while your ankle's bent. Push on that neck muscle again and see if it's stronger. If it's stronger, it tells you your foot's involved. Simple things. Did your doctor do that when you went checked him out? I guess maybe not, but little things like that will begin to tell you. If you turn your head and you're restricted, you can't go as far as you should and get it way over to the side and either way, and it hurts and you feel pressure at the back of your head. That also tells you that it may be problematic. The same thing with this side. If you can only go this far and it's not moving, you should be getting way over. If you can't do that, or when you do that, that it causes pressure at the base of the skull, that also tells you that you may have a problem. Take your fingers and go right here and push. If that hurts you right at this point, it's in the middle of the eye, right at the cheekbone. If you push there, that tells you you're not digesting properly. And because why? Because this is stomach 1 acupuncture point. If you have pressure here, you see a lot of people, they say, well, I have sinus pain. Well, you know what's right there? That's large intestine point. It could be that pressure there is there only because your gut is bad. It's because of all the garbage you put in your body. And, you're not doing what you're supposed to be doing. So many of the conditions that we see. How many of you sleep on your stomach with your head turned to the side all the time? You wonder why you got a headache? Could be. How many of you are at your computer desk and your head's like this, or you're down like this all the time, or your head's up like this all the time? Do you think that doesn't cause a mechanical disruption? I'm here to tell you it does. Look, you have the power within your hands to diagnose your own condition. If that's true, why are you letting somebody else tell you there's nothing wrong with you, or I don't know where it's coming from, or we're going to wash it to see what happens, or take this medication. If it seems to control it, you're just going to have to stay on it. Would that make you crazy? It does me. I guess that's why I do what I do and I don't do what everybody else does. Got to ask the right question. Look, we're going to continue to give you all kinds of data, ongoing information on a week-to-week basis, but I want you to use it. I want you to get out and get it done. Look, you can resolve virtually anything that goes on in your health if you understand why it's there to begin with. Why? That's the biggest clue. Why? Don't buy into, we're in a society today where you got to pick up the phone and, you can get virtually any medication that you want anymore. Things that have serious side effects. All this GLP-1 nonsense to lose weight. Nobody told you that it was going to cause cancers that are starting to show up. Yeah, you heard me, cancers. Check it out. It's there. So when you start understanding that things come at a cost, they come at a price to your health, to your ability to function, your capacity to be able to take care of yourself, your family, do your work. Isn't it important that you step up and say enough is enough, particularly when it comes to headaches, the number one most financially devastating condition of all health conditions? Why? Because it's costing your pocketbook, it's costing your family's contribution into society because they have to take care of you. They're costing your employer because you can't work at the level that you should. Even if you're working, you're missing more days than you're in office. I don't know about you, but something's not right here. And we're seeing more and more and more of this since, the last several years, with everything that's happened to us in society. We're seeing many more chronic conditions show up that are vascular in nature. Headaches are one of them. Migraines are one of them. So if that's the case, the right questions have to be answered. And you can't go with somebody who says, well, let's just see what happens. Here, let's take this and see, well, we did your blood work and I really don't see anything that's grossly wrong there. Well, if they did the blood work that they should do, number one, and they interpret it relative to functional medicine protocols, not laboratory patterns that are that big and keep getting wider and wider and wider. And why did they do that? Is because they're seeing more and more people that are outside the normal parameters. And as long as they're breathing, they got a heartbeat and walking around, and they can control the patterns with drugs. And by the way, here's something, this is coming from yours truly, from Dr. Tom. Medicine is interesting because they generally, and this has been told to me by some friends, that medical practitioners generally won't run a lab test unless they have a drug that can fix something that they are seeing that's probably not normal. Did you hear what I said? I know one of these days somebody's going to hit me and I'm going to say, just sorry, can't stand the truth, can you? But that's actually the truth of that commentary. Unless they have a way to fix it, they don't even look for it. We look between the sheets. We look at every little piece of the puzzle. We look at an ongoing process of shift and change. Is it viral? Is it bacterial? What's triggering that? What exposures do you have? Why do some people walk down the middle of 1,000 different viruses and they're fine? They don't have a problem. And some people, all they have to do is be in, 100 yards of somebody who sneezes and they're going to get it or something like that. I don't know. But we see those on an ongoing basis. Once you'd like to get your health back, listen, don't forget, March 18th, here at the Roselle Center in Fairfax, it's important that you have the tools to be able to fix what's going on with you, particularly with chronic headaches and migraines. It's not okay. Give us a call, register today, go to drtomroselle.com or rosellecare.com. And don't forget to check out our Ageless Health store. It's there for you for any kind of nutrient basis that you want. If you're not a patient of ours, go through, if you're getting something from another practitioner and you want to buy it quickly, just go to our Dr. Tom Roselle Ageless Health store, click in, and let's see what we can do to help you down that path. We're coming up to the end of the program, and next week is going to be even more interesting as I get into the depths of a couple other interesting presentations. but understand that you have the tools. I'm going to continue trying to give you more and more of that so you can ask better and better questions, that you can be your own practitioner, your own doctor, relative to digging for the underlying why is that. Don't miss an episode. Tell your friends that we're here. Check me online. We're on Facebook. We're on Instagram. We're on other things. We're done. We're finished. I'll see you next week. Be well. Remember, I love you all.
There's two kinds of love in this world. There's the kind you want and the kind you need. But everybody has the capacity to be kinda